Hey, what's up everybody? Welcome back to Zen Zone Health. I'm so glad you're here. Today we're diving into a topic that's super important for your well-being, your heart health. We're going to talk about 8 alarming signals your body might be giving you a month before a heart attack. Look, I know these videos can be a little scary, but knowledge is power, right? The more you know about your body and the warning signs it gives, the better equipped you are to take action and stay healthy. By the end of this video, you'll be able to spot these signals early on and get the help you need. So hit that subscribe button and turn on notifications so you never miss a beat, literally.
All right, let's jump right into it. The first signal we're talking about is cold sweats and dizziness. You know, that feeling where you suddenly break out in a cold sweat, even if you're not hot or exerting yourself. Yeah, that's not something to ignore. See, your circulatory system is like the delivery service of your body. It's responsible for delivering oxygen-rich blood to all your vital organs, including your brain. When your heart isn't pumping efficiently, like in the case of a heart attack, your blood flow gets disrupted. And guess what? Your brain needs a constant supply of oxygenated blood to function properly. When it doesn't get enough, you might experience dizziness, lightheadedness, or even fainting. Now, cold sweats often go hand in hand with dizziness in these situations. Why? Because your body is freaking out. It knows something's wrong and tries to cool itself down by sweating. If you're experiencing persistent cold sweats and dizziness, especially if it comes on suddenly or is accompanied by other symptoms, please don't brush it off. It's crucial to seek medical attention right away. Next up, we have chest pain or pressure. This one's a classic sign of a heart attack, and for a good reason. It's often described as a feeling of tightness, squeezing, or heaviness in the chest, and it can radiate to your arms, jaw, back, or even your stomach. This pain, my friends, is known as angina, and it's a sign that your heart isn't getting enough oxygen-rich blood. Imagine your heart is like a car engine. It needs fuel to run, and that fuel is oxygen. When the arteries that supply blood to your heart become narrowed or blocked, your heart doesn't get the fuel it needs, and it starts to complain. Now, here's the tricky part. Chest pain can be caused by a lot of things, like indigestion, muscle strain, or even anxiety. But when it comes to your heart, it's always better to be safe than sorry. If you're experiencing chest pain or pressure that lasts for more than a few minutes, especially if it's accompanied by other symptoms like shortness of breath, sweating, or nausea, don't hesitate. Call 911 or get to the emergency room immediately. Let's talk about another signal your body might give you. Weakness. You might be thinking, Dr. Mike, weakness? That's so general. Couldn't it be anything? And you're right, weakness can be a symptom of many things. But when it comes to your heart, it's a sign you don't want to ignore. See, when your heart isn't pumping blood effectively, your body goes into survival mode. It tries to conserve energy by reducing blood flow to your muscles, which can leave you feeling weak and fatigued. This weakness can be accompanied by other symptoms like sweating, nausea, jaw pain, and of course, the chest pain we talked about earlier. These symptoms together paint a clearer picture of a potential heart issue. Think of your arteries like a network of pipes. Over time, plaque can build up inside these pipes, narrowing them and making it harder for blood to flow through. This is called atherosclerosis, and it's a major risk factor for heart attacks. If you're experiencing sudden or unusual weakness, especially if it's accompanied by other symptoms on this list, it's essential to get checked out by a doctor. Now, this next signal might surprise you. Flu-like symptoms. You might be thinking, wait, what? How can I tell the difference between the flu and a heart attack? And you're right to ask. It can be tricky, but there are some key differences. When we're talking about flu-like symptoms in the context of a heart attack, we're talking about things like fever, fatigue, body aches, and chest pain. These symptoms can sometimes precede a heart attack by a few days or even weeks. Researchers believe that the inflammation caused by a heart attack can trigger an immune response in the body, leading to these flu-like symptoms. It's like your body is trying to fight off an infection, but the infection is actually a heart attack. Now, I know what you're thinking. Every time you get the sniffles, you're going to worry about a heart attack. And that's not what I want. The key here is to pay attention to the context. If you're experiencing flu-like symptoms that are severe, unusual, or don't seem to be improving, it's always a good idea to err on the side of caution and see your doctor. Let's talk about another signal that's often overlooked: chronic fatigue. We all get tired from time to time, right? But chronic fatigue is different. It's a persistent, overwhelming tiredness that doesn't go away with rest. It can make it difficult to perform everyday tasks and impact your quality of life. Chronic fatigue can be caused by stress, poor sleep, and certain medical conditions. But it can also be a sign of heart problems. When your heart isn't getting enough oxygen-rich blood, it works harder. This extra workload can leave you feeling exhausted and drained. Plaque buildup in the arteries reduces blood flow to the heart. This can lead to coronary artery disease, a major risk factor for heart attacks. If you're experiencing chronic fatigue, talk to your doctor. They can help determine the cause and recommend treatment. All right, let's talk about another common signal: shortness of breath. This one's pretty straightforward. When your heart isn't pumping efficiently, it can't keep up with your body's demand for oxygen. This can lead to a buildup of fluid in your lungs, making it difficult to breathe. Imagine your lungs are like sponges. When you breathe in, your lungs fill with air, like a sponge soaking up water. But when your heart isn't pumping properly, fluid can leak into the spaces between your air sacs, making it harder for your lungs to expand and take in air. This can lead to shortness of breath, especially during physical activity or when you're lying down. You might also feel like you can't catch your breath or like you're suffocating. Shortness of breath can also be a sign of other conditions like asthma, pneumonia, or even anxiety. But when it comes to your heart, it's always better to err on the side of caution. If you're experiencing sudden or unexplained shortness of breath, especially if it's accompanied by chest pain, sweating, or other symptoms on this list, call 911 or get to the emergency room immediately. Now, this next signal might surprise you: insomnia. You might be thinking, Dr. Mike, insomnia? Seriously? What does that have to do with my heart? And it's a valid question. It might seem unrelated, but trust me on this one. Insomnia, or difficulty sleeping, can be a sign of an underlying health issue, including heart problems. It's a bit of a chicken and egg situation. See, when you're stressed or anxious, your body releases hormones like adrenaline and cortisol. These hormones are part of your body's fight or flight response, which is designed to help you deal with threats. But when you're constantly stressed or anxious, your body stays in this heightened state of alert, which can disrupt your sleep. And over time, chronic stress and sleep deprivation can take a toll on your heart. Studies have shown that people who consistently get less than 6 hours of sleep per night are at an increased risk of developing high blood pressure, high cholesterol, and other risk factors for heart disease. So, if you're struggling with insomnia, don't just brush it off as a minor inconvenience. Talk to your doctor about it. They can help determine the underlying cause and recommend strategies to help you get a better night's sleep. Let's talk about stomach pain. Stomach pain can be caused by many things, from indigestion to stress. Sometimes it can be a sign of something serious, like a heart attack. When your heart isn't getting enough oxygen, it can cause pain in your stomach. This is because the nerves for your heart and stomach are close together. Heart-related stomach pain feels like pressure or squeezing in the chest or upper abdomen. It might come with nausea, sweating, or pain radiating to your jaw, arms, or back. If you have severe or persistent stomach pain, seek medical attention immediately.
That's it for our 8 alarming signals your body might give you before a heart attack. Remember, knowledge is power, and recognizing these signs early on can be life-saving. Taking care of your heart is crucial, and incorporating heart-healthy habits into your lifestyle can make a world of difference.
Did you know that even simple changes like adding dates to your diet can have a positive impact on your heart health? Dates are a great source of potassium and fiber, both of which are beneficial for your cardiovascular system.
If you're experiencing any of the symptoms we discussed, please don't hesitate to consult a healthcare professional immediately. And as always, thanks for watching ZenZone Health. Don't forget to give this video a big thumbs up, share it with your friends and family, and hit that subscribe button for more health tips and tricks. Stay healthy, everyone.